At 3:17 in the morning, I was urgently called to the operating room for a 74-year-old man who had gone to bed feeling perfectly fine but woke up experiencing intense chest pressure. What surprised our team was not just the heart attack itself, but what his overnight monitor revealed in the hours leading up to the event. His breathing patterns, blood pressure, and the workload on his heart had all subtly shifted during the night. The common factor tying these changes together was the position his body had been in while he slept. As a cardiac surgeon, I encounter this phenomenon far more often than most people realize. We're typically taught to view heart attacks as daytime occurrences triggered by stress, physical activity, or exertion. However, modern sleep research has uncovered that what happens to your body while you're unconscious can quietly strain your heart, compress your lungs, alter oxygen levels, and affect how hard your heart must work hour after hour. The position you sleep in directly influences your circulation, airway flow, and the return of blood to your heart. Scientists refer to this hidden strain as nocturnal cardiovascular load, meaning the unseen stress your heart endures throughout sleep. For some elderly individuals, certain sleeping positions gradually increase this load, raising their risk of cardiac events without any obvious warning signs. Over the past decade, researchers have tracked sleep posture alongside oxygen saturation, heart rhythm, and blood pressure in thousands of seniors, consistently finding that 5 specific sleeping positions correlate with increased overnight cardiac strain. In this video, we will explore these 5 positions, ranked from least to most dangerous. Stay tuned, especially for the second most risky position, which doesn't just raise your risk. It can fundamentally alter your heart's behavior overnight in ways many doctors rarely discuss with seniors. If you want to delve into the research behind these findings, all scientific sources are conveniently listed in the description below. Before we begin, let me ask, are you watching this in the United States or somewhere else? And what position do you usually fall asleep in? I read every comment and make a point to respond personally, so don't hesitate to share. Now let's start with sleeping position number 5, a posture many believe is harmless, but actually exerts unexpected pressure on your heart. Number 5 is sleeping flat on your back without any elevation. When you lie completely flat on your back without raising your upper body even slightly with a pillow, you create what cardiologists call a pooling effect in your cardiovascular system, forcing your heart to work significantly harder throughout the night. Picture your heart as a pump that must push blood against gravity to reach every part of your body. When you lie flat, all the blood that typically flows downward during the day suddenly has nowhere to go, increasing pressure within your chest cavity. Dr. Susan Redline from Harvard Medical School conducted a revealing study involving 3,000 participants monitoring heart rhythms throughout the night. They discovered that those who slept completely flat experienced, on average, 27% more irregular heartbeats compared to individuals who elevated their upper body even slightly. The explanation is straightforward once you understand it. Lying flat causes blood volume to shift from the legs back to central circulation, increasing the amount of blood your heart needs to pump with each beat, which can trigger arrhythmias in people who are susceptible. This sleeping position becomes particularly problematic if you have any degree of heart failure, even mild cases that you might be unaware of, because the excess fluid literally flows back toward your lungs and heart, making it harder to breathe and forcing your heart to work against increased resistance. Fortunately, adjusting this position is surprisingly straightforward. You can place a wedge pillow under your upper body or elevate the head of your bed by about 4 to 6 inches using blocks or bed risers, which creates a slight incline that leverages gravity to improve circulation without causing neck discomfort. Research indicates that this modest elevation can lower nighttime blood pressure spikes by as much as 11 millimeters of mercury in systolic pressure. While this may seem minor, over an 8-hour sleep period, such a reduction can be the difference between restful sleep and cardiovascular strain. You'll know you found the right angle when you can breathe comfortably without the sensation of blood rushing to your head. Many people also report less snoring and waking up, feeling more refreshed after making this simple change. The beauty of this solution is that it works passively throughout the night without requiring conscious effort. Cardiologists often suggest starting with a 15-degree incline and gradually increasing it based on your comfort and any symptoms you experience. Just thinking about this adjustment can already influence your heart rate. Imagine the impact once you try it. Now, consider what happens with the fourth sleeping position, the starfish position, where you lie on your back with your arms stretched above your head. Although it seems harmless, this posture may exert dangerous pressure on vital blood vessels supplying your heart and brain. A study conducted by researchers at the Cleveland Clinic, which involved 1,500 patients and advanced imaging techniques, revealed a troubling finding. Sleeping with your arms elevated above shoulder level for extended periods can compress the subclavian arteries and veins, reducing blood flow by up to 40% and causing a condition known as thoracic outlet syndrome during sleep. Here's what occurs inside your body. Raising your arms overhead pinches the space between your collarbone and first rib through which major blood vessels pass. This compression doesn't only impact your arms, it causes a backup throughout your circulatory system, forcing your heart to work harder. What's particularly concerning is that many people who sleep this way wake up with numbness or tingling in their arms and dismiss it as a harmless arm falling asleep. However, this numbness is actually a warning sign that blood flow is significantly restricted. For those with underlying cardiovascular problems, this added strain can lead to irregular heartbeats or even blood clots. A landmark study published in the Journal of Cardiovascular Medicine tracked 800 individuals who routinely slept in the starfish position and found a 34% higher rate of morning cardiac events compared to people who kept their arms at their sides. The risk is especially pronounced in those over 50 or with diabetes. Moreover, the compression affects more than just blood vessels. When your arms are overhead, the vagus nerve, a key player in regulating heart rate and blood pressure, is stretched. This stretch can cause sudden drops in heart rate that might feel relaxing, but can actually decrease blood flow to essential organs during critical stages of sleep. To avoid this risky sleeping position, experts recommend using body pillows on both sides to block your arms from drifting upward, encouraging a safer posture throughout the night. These pillows act as physical barriers, preventing your arms from creeping toward your head or chest, which can often lead to nerve compression or impaired blood flow. Alternatively, try the butterfly position, which involves resting your hands gently on your stomach or chest, a posture that naturally relaxes the shoulders and helps maintain proper spinal alignment. This position also keeps blood vessels free from obstruction, promoting smoother circulation and reducing the likelihood of waking up with numb or tingling limbs. Transitioning to these new sleeping habits can take about 2 weeks, a period during which you may need to consciously reposition yourself multiple times each night as your body gradually breaks the ingrained habit of raising your arm. Most people find that once they successfully adopt these safer positions, their overall sleep quality improves significantly. They experience less morning arm numbness and discomfort, symptoms they may have previously assumed were normal or unavoidable. It is a common misconception that raising the arms during sleep aids breathing, but in reality, the cardiovascular risks far outweigh any potential benefits. Other sleeping positions can enhance breathing efficiency without compromising circulation or causing nerve compression. For those concerned about blood vessel compression, it's important to note that the next position discussed literally alters pressure inside your skull, introducing a different set of risks. Before moving on to that, if you found this information helpful, please like and subscribe for more detailed health insights. Now let's examine the third position, sleeping on your stomach with your head turned to one side. While many find this position cozy and comfortable, it poses significant cardiovascular stress, which cardiologists particularly warn about for individuals with existing heart disease or stroke risk factors. Sleeping face down with your head twisted to the side places considerable strain on the cervical arteries. These arteries are vital as they supply oxygen-rich blood to the brain. According to research from UCSF, this neck twisting can reduce blood flow by up to 50% on the opposite side of the head during the night. This effect is akin to twisting a garden hose for 8 hours straight, which over time stresses the neck vessels, accelerates arterial damage, and raises the risk of stroke, especially in older adults or those with pre-existing vascular issues. Beyond the neck, stomach sleeping compresses the chest cavity, forcing the heart to work harder as it pumps blood against the added pressure from the body weight pressing down on the thorax. This compression increases intrathoracic pressure and impedes the return of blood from the limbs, further stressing cardiovascular function. Dr. James Parrish from the Mayo Clinic has found that individuals who sleep on their stomachs show on average a 15% higher overnight blood pressure compared to those who sleep on their sides, with dangerous spikes particularly during REM sleep phases, when the heart is more vulnerable. Additionally, restricted breathing in this position adds another layer of risk. Sleeping face down limits the expansion of the chest and lungs, causing you to inhale higher amounts of carbon dioxide and lower amounts of oxygen. This imbalance acidifies the blood and forces the heart to pump harder to compensate for reduced oxygen delivery. The risk is especially pronounced for overweight individuals or those with sleep apnea, as the combined effect of chest pressure and restricted breathing can lead to positional hypoxia, a slow suffocation that often goes unnoticed while the heart compensates by beating faster. Over time, these factors contribute to chronic cardiovascular strain, increasing the likelihood of serious health complications. Breaking the habit of sleeping on your stomach requires a thoughtful strategy. One effective method is to place tennis balls or foam rollers beneath your chest to make stomach sleeping uncomfortable, encouraging you to shift positions. Alternatively, investing in a body pillow that you hug from the side can provide the same sense of security without compromising your cardiovascular health. Some individuals find success by gradually transitioning through what sleep therapists refer to as quarter turns. Beginning by sleeping on your stomach but slightly rotated to one side, then slowly increasing that rotation over several weeks until you feel comfortable sleeping entirely on your side. Patience is crucial in this process, as stomach sleeping is often a deeply ingrained habit from childhood. However, the cardiovascular benefits of switching to side sleeping become noticeable within just a few weeks, with many people reporting improved morning energy and fewer headaches after making the change. Your neck arteries will already be benefiting from this adjustment, but the position you choose next can impact an even more critical aspect of your health. Sleeping on your right side in a fetal position, for instance, might be surprising because side sleeping is generally recommended, yet this specific posture presents unique cardiovascular challenges that researchers are only beginning to fully understand. These findings are particularly concerning for individuals with heart disease risk factors. When you curl up on your right side, your heart, located slightly to the left in your chest, must work against gravity, pumping blood uphill through your aorta. While this may seem like a minor issue, Stanford University cardiologists discovered that this position can increase the heart's workload by as much as 23% throughout the night. The fetal position exacerbates this problem because drawing your knees toward your chest compresses your diaphragm, reducing your functional residual capacity, the volume of air remaining in your lungs between breaths that keeps them partially inflated and ready for oxygen exchange. This compression means your heart must work harder to oxygenate your blood since your lungs are not functioning at full efficiency. For those with existing cardiovascular conditions, this additional strain accumulates over thousands of hours of sleep across a lifetime. From a medical standpoint, the situation becomes even more significant considering the location of your body's largest vein, the inferior vena cava, which runs along the right side of your spine and returns blood from your lower body to your heart. When lying on your right side, the weight of your organs can partially compress this essential vessel, leading cardiologists to describe the resulting condition as venous congestion in the lower extremity. A comprehensive study published in the European Heart Journal tracked 5,000 participants over 3 years and found that habitual right-side fetal sleepers experienced 31% more episodes of nocturnal leg swelling and 28% higher rates of varicose veins compared to those who slept on their left side. This suggests that the circulatory compromise in this position is substantial enough to cause visible vascular health changes. Additionally, a tight curl of the fetal position negatively impacts cardiac output. The volume of blood your heart pumps per minute. Because when your body is scrunched up, the blood vessels in your abdomen and chest become compressed, creating resistance that your heart must overcome with every beat. Sleeping on your right side can cause your liver, the heaviest internal organ in the human body, to press down on your digestive system, leading to increased pressure within your abdominal cavity. This elevated pressure then pushes your diaphragm upward, which in turn reduces lung capacity and makes it more difficult to take deep, restorative breaths. Moreover, this compression forces your heart to work harder to maintain efficient circulation through the abdominal vessels that are being squeezed, potentially increasing cardiovascular strain over time. Instead of avoiding side sleeping altogether, which many find uncomfortable or disruptive, you can adjust your technique to significantly reduce these negative effects. For example, placing a firm pillow between your knees helps prevent excessive hip rotation, which keeps your spine properly aligned and reduces undue stress on your lower back. Additionally, consciously extending your body rather than curling up tightly, by imagining gentle string pulling from the top of your head to elongate your torso, can promote better posture and alleviate pressure points. Alternating between right and left side sleeping throughout the night is another viable strategy, though it's important to be aware that left side sleeping carries its own surprising and less commonly discussed risks. Many individuals find that placing a small pillow or a rolled towel behind their back can effectively stop them from rolling fully onto their right side while still allowing them to sleep comfortably on their side, thereby significantly reducing cardiovascular strain and improving overall sleep quality. The most surprising and often overlooked risk involves the number one recommended sleeping position, left side sleeping with poor neck alignment. Although widely advised by doctors, especially for pregnant women and individuals suffering from acid reflux, this position can become the most dangerous when combined with improper alignment of the neck and spine. Cardiologists have identified a condition called cardiac compression, which affects millions of people nightly and was uncovered in a large-scale study conducted at Mount Sinai Hospital involving advanced cardiac MRI scans of 3,500 participants. The study revealed that sleeping on your left side with your neck bent more than 15 degrees, a common occurrence with most standard pillows, allows your heart to shift and rotate within your chest cavity, pressing against your left lung and causing mechanical stress on the cardiac muscle. Biomechanically, the heart is suspended in the chest by blood vessels and surrounded by the pericardium, a protective sac, but it isn't firmly anchored in place. Gravity pulls your heart down and to the left when lying on that side, and if your neck and spine are in line properly, the heart presses against the rib cage, creating positional cardiac stress that can have significant long-term consequences. The data is especially alarming. Those who habitually sleep on their left side with poor alignment experience 47% more premature ventricular contractions. Those unsettling skipped heartbeats detected during sleep monitoring. Over time, this constant mechanical irritation can lead to electrical instability in the heart's conduction system, increasing the risk of arrhythmias. The situation worsens when neck misalignment triggers a chain reaction down the spine, impacting the autonomic nervous system, specifically the sympathetic nerve fibers responsible for regulating heart rate and blood pressure, which can result in inappropriate activation of the fight or flight response during what should be restful sleep. A groundbreaking study from Johns Hopkins University found that participants who corrected their left side sleeping posture reduced their risk of nocturnal cardiac events by an impressive 48%. However, most people remain unaware of their misalignment because it feels normal after years of sleeping that way, underscoring the importance of proper sleep ergonomics for cardiovascular health. Symptoms such as morning heart palpitations, chest tightness, or shortness of breath are frequently overlooked or misattributed to anxiety, stress, or simply the natural aging process, rather than being recognized as consequences of sleep position and posture, which are often underestimated factors in cardiovascular health. One critical factor often missed is the role of the vagus nerve, a key component of the parasympathetic nervous system that runs down along the left side of the neck and plays an essential role in regulating heart rate by helping to slow the heart during sleep, thereby promoting relaxation and recovery. When the neck bends unnaturally or assumes a poor angle during sleep, this nerve can become compressed or irritated, leading to a condition known as vagal insufficiency. This compression prevents the vagus nerve from performing its function effectively, which means the heart does not slow down as it should at night, resulting in continuous cardiovascular stress that over time can contribute to more serious cardiac problems such as arrhythmias or hypertension. Furthermore, sleeping on the left side with improper spinal alignment can cause the stomach to press upward against the diaphragm, which then disrupts the heart's rhythm in a phenomenon sometimes referred to as the cardiac hill effect. This mechanical interference helps explain why some individuals wake up experiencing both heartburn and palpitations simultaneously, symptoms that are often dismissed or treated separately without recognizing the underlying biomechanical cause. Addressing these issues involves carefully realigning the neck and spine to restore proper function and relieve nerve pressure, which can be achieved through targeted adjustments and supportive sleep accessories. Using a contoured pillow specifically designed for side sleepers can provide the necessary support to maintain alignment, while placing an additional pillow between the arms helps prevent the shoulders from rolling forward or inward, which exacerbates poor posture and further compresses the vagus nerve. Achieving a neutral spine alignment where the ear, shoulder, hip, and ankle all line up in a straight natural line is critical for reducing strain and improving overall sleep quality, although it may feel uncomfortable at first as the body adjusts to a healthier posture and new muscle engagement patterns. In addition to pillow support, selecting a firmer mattress or mattress topper can prevent the hips from sinking too deeply, which helps maintain this alignment throughout the night and supports spinal health. While it often takes several weeks for the body to fully adapt to these changes, improvements in heart rate variability, a key indicator of cardiovascular health and autonomic nervous system balance, can be observed within the first week of correcting sleep posture. Many people report that their morning palpitations and chest discomfort diminish significantly or even disappear altogether during this period, leading to better days and reduced anxiety around sleep. Importantly, the goal is not to avoid sleeping on certain sides entirely, but to modify sleep positions with the right support and alignment strategies, as these small but consistent changes made nightly can accumulate over time to produce substantial benefits for heart health, respiratory function, and overall longevity. For those seeking to enhance their health and well-being, paying close attention to sleep posture and making these adjustments is an effective and accessible way to begin. To continue receiving detailed health insights and practical tips for safer, healthier sleep habits, consider subscribing and take the first step toward a more restful, heart-friendly night tonight.